So today, our research focuses on trying to understand how physicians communicate with patients who are looking for what we call unregulated or unproven stem cell and regenerative medicine interventions. To date, no one has done any kind of systematic analysis of how physicians communicate with patients considering these unproven and unregulated stem cell interventions. Our study in Mayo Clinic Proceedings aimed to bridge this gap. Hello, my name is Dr. Zubin Master. I am an associate professor of biomedical ethics in the Biomedical Ethics Research Program and the Center for Regenerative Medicine. The title of our paper is Academic Physician Specialists' Approach to Counseling Patients Interested in Unproven Stem Cell and Regenerative Therapies, a Qualitative Study. This article will appear in the December 2021 version of Mayo Clinic Proceedings. In the US alone, there are about 1,200 clinics that offer these stem cell and regenerative interventions, but this marketplace is international. Many of these interventions have little or no scientific evidence, and several studies have shown that in some cases, when patients take them, it can actually be harmful when given outside of a sort of a well-controlled clinical trial or clinical environment. Many of the small clinics that offer these stem cell interventions do not offer whole person care. Patients come in, they receive one of these stem cell interventions, and then they leave. There is no ongoing monitoring, no follow-up, and no other options are presented to them, just the stem cell intervention. The industry flourishes on misinformation generated by many of these clinics and how they evade regulations and regulatory enforcement, and basically take advantage of the willingness of patients who have very few options left or no options left and are what we call, suffering and in a lost frame and are willing to pay for an unproven intervention out of their own pocket. Our long-term goal is to create a framework and accompanying material that facilitate communication between physicians and patients who consider unproven and potentially risky interventions outside of a clinical trial context. We want to facilitate best practices in physician-patient communication in order to enhance patient autonomy and help physicians correct misinformation. So what we did was we undertook a study of 25 specialists, and we conducted interviews with them. We identified specialists in cardiology, ophthalmology, orthopedics, pulmonology, and neurology in 5 different specialties. The inclusion criteria for all of these specialists to be included in our study was that they had to have experience with at least addressing at least one patient question around unproven stem cell interventions. So we did take a conservative approach. All of our specialists had at least some experience dealing with these types of questions. We found that specialists we interviewed used 2 types of approaches to discuss unproven stem cells with their patients. They provided information, so we call these informational approaches, and they also showed empathy and care in how they communicated with patients. So we call these relational approaches. Interestingly, orthopedists amongst the other specialists tended to gravitate towards informational approaches. So informational approaches included explaining stem cell science, where physicians would use various different types of analogies to explain the complexity of stem cell science. They talked about the risks and the concerns that they had about unproven interventions, such as physical harm and financial risks. In many cases, they also tried to set realistic expectations. And also, in some cases, they would review the materials that patients identified by sitting down in front of a computer and actually going to a website and talking about the different claims that were made on it. So given that many patients had quite severe conditions, several physicians also used what we classified as relational approaches. By relational, we included things like saying that, the physician wants what is best for the patient, acknowledging their suffering or worries or fear, reassuring the patient that they would give continued care no matter what decision they made, also showing and communicating empathically, and clearly stating that patients have the final decision in their care. So these were sorts of relational approaches that many of the physicians used in our study. Our study also showed that generally specialists were quite comfortable having such conversations with patients because such conversations about unproven interventions is somewhat routine to them. Specialists acknowledged various tensions that they encountered in these conversations. For example, wanting to support the patient's decisions, but also worrying that they may face, harms or external pressure to undertake an unproven intervention. Also, how do you adequately address hype and misinformation after they left the clinical setting? Also, ensuring that they set adequate expectations for patients that had high hopes in an unproven intervention. And also, specialists did offer resources, including statements, media articles, research articles, and specific trials to patients. So specialists also offered patients a range of different resources, including statements from scientific societies or clinical societies, media articles, research articles, and information from various patient advocacy groups. In most cases, specialists were generally comfortable talking about this, but in some cases, especially to more junior clinicians did express greater interest in actually getting more guidance on how best to communicate with patients, and also wanted more resources on how best to communicate with patients regarding unproven stem cell interventions. So what are the implications of our study? So our research study adds to the general understanding of how to best counsel patients considering any kind of unproven intervention. And specifically, of course, stem cell or regenerative interventions. We also found that more junior physicians require greater guidance and mentorship. And this speaks to the idea that maybe at the end of the day, we would want to make some kind of a shared decision-making tool on how to have best practices in counseling patients who query their physicians about unregulated stem cell and regenerative interventions. I invite all of you to read this article, as I believe it will be informative to all of your clinical practices, as unregulated stem cell interventions affects every clinical practice, and it would be great to know a little bit more about it and how to best counsel patients seeking unproven, unregulated regenerative interventions. Thank you.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.